Hi, my name is Vivi Orozco. I will be conducting a physical assessment on my patient, Ms. Patches McKibben. It is August the 30th, 2025, and I believe it is a little after 9 o'clock right now. So I will begin by knocking on my patient's door and asking permission to enter. Hello. Hi, can I come in? Thank you. My name is Vivi. I will be your nurse tonight. How are you? Great. So I'm washing my hands. Could I please get you to state your full name and date of birth for me? Thank you. Thank you very much. So your provider has entered some orders for some medications and some additional testing, including lab work. But prior to doing that, I would like to do a head-to-toe assessment. It takes about 10 minutes. There's no pain involved. If at any point you're uncomfortable, you just need to let me know and we'll stop and reassess at that point. Great. Okay, perfect. So I'll start with getting a set of vitals on my patient, which includes a temperature, pulse oximeter, respiratory rate, heart rate, and blood pressure, sorry. So we'll go ahead and get that. This will be a little tight, but it'll just last a few minutes, and that's the blood pressure cuff. As soon as I finish taking that, I will remove the blood pressure cuff. The temperature will be tympanic. Respiratory rate and heart rates I will obtain when I'm doing the rest of the assessment. And the pulse oximeter I'm placing on her hand as well. So to begin, I'm going to ask, do you have any allergies that you're aware of? And on a pain scale from 1 to 10, are you having any pain? And then just rate that for me and tell me where you're having that. So I'm getting a 3 to 4, and that's for a headache, and we can take care of that. I will just complete the assessment, and then I will go and bring that medication along with the other ordered medications. Okay, perfect. So I'm going to ask Ms. McKibben to lean forward so that I can start her assessment on her head. The back of her head looks symmetrical. There's no bumps, no lesions, no abrasions, no infestations. The front of her head, the same. No abrasions, no infestations, no lesions. The face, the shape of the head is symmetrical. Her hair is clean and groomed. I'm going to go over to her eyes. If I could get you to stare at the light, please. Perfect. Perfect. What I'm going to do next is do the exact same thing, but actually look at the other eye, the opposite eye, and see if it's reacting. And it is. So now I will go over to the right eye and see if the left eye is reacting. And it is. So her eyes are, just continue to stare at the light. Perfect. Now if I could get you to look at the dots on the wall. Perfect. Now at the light again. Now at the wall. So her eyes are normal. They're responding normally. They are equal, round, and reactive. Next is I'm going to look at her nose. So I'll ask her to put her head back, look up into her nares. I'm looking at the mucous membranes, looking for drainage, swelling, deviation in the septum, possibly. Everything appears to be normal. Ms. McKibben is telling me that she's not had any issues with drainage. I'm going to look in her mouth. And in her mouth, I'm looking to see, number one, does she have her teeth, or does she have dentures, or partial, or any implants? I'm looking at the mucosa membrane. I'm looking at the size and shape of her tongue to see if there's any lesions, abrasions on her gum line, and the pharynx. I'm looking at her adenoids and her tonsils. Asking her to stick her tongue out as far as she can, and I'm also asking her to smile to see if her smile is symmetrical. Everything appears to be normal. The mucosa membrane is moist and pink. There's no abrasions noted in any of the oral cavity. Next, I'll be looking at, well, let me go back. She has all her teeth. There's no partials. There's no implants. Nothing of that nature. Now I'm going to look in her ears. I'm looking at both ears with an otoscope, looking for any redness, swelling, drainage. Miss McKippen, do you use any hearing devices? And that response is a no. Are you exposed to any loud noises, environmentally wise, at home or at work? That again is a no. She has no hearing issues. There's no drainage. And there is no issues with the skin, no skin breakdown at all around the ears. I'm now looking at the neck, feeling it's soft and supple. I'm going to check the carotid pulses. I'm going to listen for a bruit. That would be that large swishing sound. And then I'm looking at the neckline to look for any abnormal distensions, jugular vein distension, goiter, thyroid. Everything seems to be normal. There's no abnormal bumps or edema or swelling around the neckline. I'm going to ask the patient to flex and extend her neck, Miss McKippen, if you wouldn't mind. Just flex and extend, and then turn your head to the left and to the right as far as you can. I've looked at the back of her neck, the back of her head, her neck. Skin is intact, dry and moist. Dry and pink, and appropriate for her ethnicity. The next thing I'm going to do is look at the skin on her arms. There is no abrasions, no lesions. Skin is dry, intact, warm to the touch. I'm looking at her nail beds. Her capillary refill is less than 3. Same on the left arm. I'm feeling for pulses. Pulses are equal and normal. Then I'm going to listen, auscultate her lungs. Ms. McKippen, I'm going to listen to your lungs in the front and in the back. Each time I move my stethoscope, if you wouldn't mind taking a deep breath, I would appreciate it. Thank you. Anterior-wise, her breath sounds are clear throughout all lung fills. There's no rales, wheezes, bronchi. My patient is telling me she's not experiencing any shortness of breath. So now I'm going to have her lean forward, and I'm going to listen to the back, posteriorly. I've listened to all lung fields. I'm expediting it, obviously. Again, all lung fields are clear. She's moving air throughout easily. There's no accessory muscles being used, no intercostal pulling, no nair flaring. My patient has shared that she is not having any shortness of breath, nor has she had shortness of breath. The next thing I'm going to do is listen to her heart. I will get respiratory, I obtained respiratory rate, which was normal. Um, and I will obtain her heart rate as I'm listening to her heart. I will also obtain an apical heart rate. So for the apical, I'm going to ask my patient to lie down just because it's easier since she's a woman to get under the breast, and then it's um, more accurate. And I would also like to share that every auscultation that I'm doing is underneath the patient's gown, never above the gown under any circumstances unless it's absolutely an emergency. But when you listen to breath sounds or heart or abdominal and you're listening through clothing, you could get artifact sounds leading you to believe that maybe your patient is wheezing or having abnormal breath sounds when it's actually the clothes that's causing it, or the clothes could impede from you hearing breath sounds that are critical for you to hear. So it's always best to listen underneath the gown. Do your best to um, give the patient their privacy and keep them covered up as much as possible. Since I have a female patient and she is in a hospital gown, I can easily slip my gown under to get that apical pulse, either this way or this way if I'm on the other side of the bed. So I'm going to go down mid-clavicle to the 5th intercostal, and I'm going to listen for 1 full minute. And for time's sakes, I'm not going to listen for the full minute, but my patient will have a heart rate of 68, a normal rate, normal rhythm, nothing abnormal. So I have listened to that while I have her lying down. I am going to also assess abdominal wise, again underneath her gown. So with the abdominal, you want to listen first to all 4 quadrants. You want to look at the skin and look at the area. It's not distended. The umbilical cord is midline. Everything seems to be normal. My patient is telling me that her last bowel movement was earlier today, this morning, and she voided earlier this afternoon. There was nothing abnormal about either one of them. Next thing I'm going to do is palpate and see if there's any tenderness, any guarding. When you're checking that, you want to try and distract the patient by having a conversation with them, and then see if they react with the guarding or grimacing. If you know that they're in for a specific thing, gallbladder, liver, you want to start with the palpating as far away from that organ as possible. And then the sounds that you'll hear, if it's like a solid, dull sound, you're over an organ or fluid. And if it's like a drum sound, a tympanic drum sound, it's very different. They're 2 very different sounds. When you're palpating, that is like air. And then with the auscultation, if you hear hypotonic, it could be hold on. Hyperactive could be that it's an infection, or they're trying to get past a blockage. And hypoactive and hyperactive. Hypoactive is there could be an issue with the ileus, and the hyperactive is it's actually trying to move whatever is in the intestine, so it's working harder, and you'll hear that. While I have her lying down, I'm going to check her lower extremities. I'm checking for edema, turgor, differentiating in color of skin, temperature differences, pain differences. She has no edema. Her skin turgor is normal. I'm going down. I'm going to check pedial pulses. They are both normal. If you feel anything that's different in the regularity or in the strength of the pulses, you want to make note of that. I'm also going to be checking the tibialis pulses as well. Let's try toward the inner. There you go. And then I'm going to ask my patient. Everything is normal leg-wise. I'm going to ask my patient to sit up. We're going to check her strength of her arms. She's going to push in for me and push out and pull forward and pull out. And she's going to do the same thing with her legs. All extremities are at a 5. My patient's physical assessment is complete. Thank you.